A series of new ingredients entered the food supply in the 1970s. They became common through routine manufacturing and labeling. Their long-term effects on health would only become a subject of study much later. This was not an isolated event, but one component of a broader industrial transition. The shift happened in manufacturing facilities, in boardrooms, in laboratories funded by companies whose names appeared on every shelf. It happened in language, too. Words like fortified, enriched, enhanced. These weren't warning labels, they were selling points. The implication was clear. What came before was lacking. What came now was complete. At the time, this was considered normal. The changes were incremental enough that each one, on its own, seemed minor. A different oil used in frying, a new stabilizer added to bread, a sweetener that didn't come from cane or beet, but from a laboratory process involving corn and enzymes. These weren't presented as experiments, they were presented as solutions to problems most people didn't know existed. Spoilage, cost, shelf life, distribution at scale. And they worked. Food stayed fresh longer, it traveled farther, it cost less. From a logistical standpoint, the system had become more efficient. From a profit standpoint, it had become more sustainable. What wasn't discussed as openly was what had been removed to make that possible, or what had been added to replace it. The food industry in the mid-20th century faced a very specific problem. Traditional food production, farming, harvesting, processing in small batches, distributing regionally, couldn't keep pace with population growth, urbanization, and the demands of a global market. The solution wasn't to scale the old methods, it was to redesign the methods entirely. Hydrogenation became standard. It turned liquid oils into solid fats that didn't spoil, didn't separate, didn't require refrigeration. It made mass production feasible. High-fructose corn syrup replaced sugar not because it tasted better, but because it was cheaper to produce and easier to integrate into industrial recipes. Preservatives extended shelf life from days to months. Emulsifiers kept ingredients bound together that would otherwise separate. Flavor enhancers compensated for what was lost when food was stripped down to its most stable, transportable form. None of this was hidden. It was printed on the label. But the label didn't explain what those ingredients did inside the body over time. It didn't explain why food that could sit on a shelf for a year might behave differently in a digestive system than food that spoiled in a week. It didn't explain the difference between eating something that had been alive recently and eating something that had been engineered to resist decay indefinitely. Most people didn't question it. There was no reason to. The food was approved. It was sold in trusted stores. It was eaten by everyone. It was served in schools, in hospitals, in government cafeterias. If it wasn't safe, surely someone would have said something. Surely there would have been warnings, recalls, public announcements. The absence of alarm was taken as confirmation, and so it blended into everyday life. Children growing up in the 1980s and 1990s didn't know that the food they were eating had been fundamentally redesigned within their parents' lifetime. To them, this was just food, brightly colored, conveniently packaged, shelf-stable, consistent. A snack cake bought in California tasted identical to one bought in New York. A fast food meal in one state was engineered to taste exactly like the same meal in another. There was comfort in that consistency. It implied control. It implied standards. It implied that someone, somewhere, had thought this through. But the standards being met weren't nutritional. They were industrial. The goal wasn't to nourish, it was to scale, to distribute, to maximize profit per unit while minimizing spoilage, waste, and production cost. Nutrition was a secondary concern, addressed through fortification, adding back synthetic versions of vitamins that had been stripped out during processing. The logic was that if you removed 10 nutrients and added back 3 in synthetic form, you could still call it enriched. Most people never noticed this at the time. They noticed convenience, they noticed price, they noticed that food was abundantly available in a way it hadn't been for previous generations, and that felt like progress. It felt like things were getting better. The real impact appeared years later, not in the form of immediate illness, but in the form of shifting baselines. A generation of children grew up with taste buds calibrated to artificial flavors, with hunger signals disrupted by foods engineered to be hyper-palatable but not satiating. They grew up in bodies that didn't quite know when to stop eating because the signals that regulated appetite, signals that evolved over millennia in response to whole foods, were being triggered by substances those systems had never encountered before. By the time consequences were visible, habits were already set. The food environment had fully transformed. Cooking from scratch had become a hobby, not a necessity. Processed food wasn't an occasional convenience, it was the foundation of most meals. And the industries that produced it had become so large, so economically significant, that questioning their products felt like questioning the economy itself. This wasn't the result of individual bad choices. It wasn't laziness or ignorance or lack of willpower. It was the result of a structural redesign that prioritized one goal, profitability at scale, and subordinated everything else to that goal. The system wasn't broken, it was working exactly as designed. The companies that led this transformation weren't acting in secret. They published research, they lobbied for favorable regulations, they funded studies that supported their products and discredited concerns. They advertised relentlessly, not just to adults, but to children, shaping preferences before critical thinking could develop. They worked with schools, with hospitals, with government programs to embed their products into institutions people trusted. And when evidence began to accumulate, evidence linking certain additives to behavioral changes, certain oils to inflammatory responses, certain sweeteners to metabolic disruption, the response wasn't to remove the substances, it was to question the evidence, to demand more studies, to argue that correlation wasn't causation, to shift focus onto personal responsibility, portion control, and exercise, to make it about the individual, not the product. This strategy was effective because it aligned with cultural narratives people already believed. The idea that health was a matter of personal discipline, the idea that if something was legal to sell, it must be safe to consume. The idea that progress was inherently good and that questioning it was nostalgic or irrational. But the bodies didn't stop responding. Rates of conditions that had been rare in previous generations began to climb, not because people suddenly became weaker or lazier, but because the environment had changed in ways that human biology wasn't equipped to handle. The mismatch wasn't between people and food, it was between evolutionary biology and industrial chemistry. Children born in the 1990s and 2000s inherited a food system that had already been transformed. They had no memory of what came before. To them, this was normal. Food that didn't spoil, food that came in packages designed by psychologists to maximize appeal, food that tasted the same every time, everywhere, because it was manufactured to precise specifications in facilities that treated ingredients like raw materials in a chemical process, not like living things that had recently been plants or animals. And the process continued to accelerate. New additives were introduced, new processing methods were developed. The definition of food continued to expand to include substances that would have been unrecognizable as food to someone from a previous century. Protein isolates, texturized vegetable protein, maltodextrin, carrageenan, xanthan gum, substances that served functional purposes in manufacturing but had no established role in human nutrition. The long-term effects of consuming these substances in combination over decades were largely unknown, not because they had been studied and found safe, but because the studies hadn't been done. The assumption was that if individual ingredients passed safety tests, tests often conducted or funded by the companies producing them, then combinations of those ingredients, consumed daily over a lifetime, would also be safe. This assumption was never proven. It was simply made, and by the time questions began to surface, entire generations had already been exposed. The redesign of the food system wasn't an accident. It wasn't the result of ignorance or oversight. It was intentional. It was strategic. It was driven by a very specific set of priorities that had nothing to do with human health and everything to do with manufacturing efficiency, distribution logistics, and profit margins. The people who made these decisions weren't evil. They were optimizing for the metrics they were given: reduce costs, extend shelf life, increase yield, maximize shareholder value. Within that framework, they succeeded brilliantly. The food system they built could feed billions of people. It could deliver consistent products across continents. It could generate enormous wealth. What it couldn't do was nourish people in the way food had nourished them for millennia, because that was never the goal. And this wasn't the only change. Similar decisions followed in other domains: in agriculture, in medicine, in education, in media. Decisions made for efficiency, for scale, for profit, with human well-being treated as a secondary consideration, something to be managed or mitigated rather than prioritized. The pattern didn't stop there.